If you're working the face, I always do this pre-microneedling, pre-nano-peel. This helps to prevent the possible side effect of breakouts post-treatment. And again, we're still working in that lymph drainage pattern, so very light, minimal pressure, but everything draining up. And you guys will see by the end of treatment, all of that motion up and towards the heart, all of that draining is going to give a nice lift. It's going to de-bloat just by getting all of that lymph fluid moving through the body. It's surprisingly light, the pressure. But it's like when you do facial massage. So you're lifting gently throughout the treatment as you're cleansing, as you're applying the serums, the masks, everything you do, you're lifting. And by the end of treatment, you see how the client looks like they had a mini facelift. It's the same thing with the body. And what's really beautiful is that it's super gentle. This is something you can teach your clients. Everything's very intuitive, as long as you move through it mindfully. All right, we've got a nice clean treatment surface. I don't have time to show you guys everything, so I do want to talk through a few other options that you can do. And once you have the protocol, you can customize, you can pick out what you have time for, what your client is interested in, and go from there. I would like to recommend avoiding having your client book one modality and do add-ons. Your clients simply don't understand the benefits of everything. So instead, I highly recommend having one treatment and including everything that the client needs. You know, you could have a signature body treatment and an upgraded premium version. I always send the client home with post-care and everything that they need to uphold results. And if they book a series with you, you could even include one of these devices. So you could do galvanic, that again, in the same pattern that we're working, everything up and draining towards the heart. That with LED will help increase blood flow. It will help with stimulating our collagen production. And again, moving in this lymph drainage pattern. So you could do galvanic next. You could do LED with ultrasonic vibration. That also helps to move the lymph, and it's a really wonderful treatment that you can retail to clients. But instead, we want to increase results a bit more. Let's go with the microcurrent. There's a ton of really amazing microcurrent devices here on the show floor. The specific device I'm using has a face and body setting. Always make sure you follow your manufacturer's instructions and never try the body setting on the face because you will light up your client. You don't want them to jump off your treatment table. Use a conductor. I'm using a peptide-infused conductor jelly. I love using a conductor jelly that has skin bennies in it. And again, everything that I apply is working up. Using the same pattern, working everything up and draining out.
The protocol will eventually sequence of the body.
It will, and it will also give you guys options to switch out and use other devices. So if you would rather use something for skin brightening, I would go with an ultrasonic LED. The LED is going to help brighten the melanocytes on a cellular level, where this is going to stimulate ATP and energy production. So if we are working on skin lifting and tightening, especially, if you have a booty facial and you want to lift the booty, microcurrent, absolutely. If you have a skin brightening client who has some darkening in through the bikini line or in through the underarms, again, I would do the ultrasonic LED infusion. So you can really mix and customize with whichever treatment is speaking to your client. Working into these lymph nodes right here that are going to eliminate microneedling. Because you're only treating the size as large as a sheet of paper, you can continue to treat other areas, but you want to wait until the area that you've just worked on has fully healed. And that's because you have all of these T cells, your immune responders, that are being rushed to that area to help arrest inflammation. So that's the same reason for why you don't want to work on a client who's sick, because they already have these T helper cells that are being activated to help the body reduce inflammation internally.